Happening today, a critical chapter in the fight against COVID-19. A CDC advisory committee voting on who should receive a vaccine first. Recommendations call for frontline healthcare workers and those in nursing homes to be the first in line. Our state is already making plans once the CDC and FDA give the green light for a plan. Governor Brian Kemp just extended the COVID-19 restrictions that went into effect at midnight in order to get ready for it all. We have team coverage for you. Liza Lucas in Fulton County with more on Pfizer and Moderna's vaccines, where they stand. But first, Joe Ripley live in Atlanta with our state's plan on vaccine distribution.
Yeah, well, Georgia Governor Brian Kemp saying that this plan submitted and approved by the CDC a couple of weeks ago would roll out in 4 phases. Let's break those down for you right here. First, phase 1, that vaccine would go to healthcare workers, first responders, as well as people over the age of 60 with, quote, multiple underlying conditions. Phase 2 of the vaccine distribution plan includes school and child care workers, along with essential workers such as truck drivers, grocery and food processing workers. Phase 2 also expands vaccine distribution to homeless shelters, jail staff, anyone over 60 and anyone under 60 with what the plan calls significant underlying conditions. Phase 3 includes people ages 18 to 30 and moderate exposure risk occupations like hairstylists and restaurant employees. And Phase 4 would include anyone else recommended to need the vaccine.
Expect to be able to begin vaccinating individuals by the 2nd or 3rd week in December. Obviously, that timeline could change.
Well, the governor's executive order also allowing for pharmacists and nurses to administer this vaccine in a drive-through setting and for them to be able to stay with that patient for 15 minutes following that vaccination. The governor is saying that this would make the vaccine more widely available for them.